So here at Vanderbilt, we partnered early on with Nuance to use some of that technology and infrastructure they had to come up with skills and routines that we could use to make calls to the electronic health records, ask simple questions about information in the patient's chart, their labs, a summary of the information, and get information back out. So I use the Havoc voice assistant quite often when I'm perusing the chart. After my clinics, I'm trying to find pieces of information, putting things together. When I'm documenting and I just have a quick thought that I want to call out to ask myself a question about a lab or the next follow-up visit, something along those lines. And what I found is that it's easy to just kind of make those requests out loud and get the information you need, as opposed to having to leave your workspace to go somewhere else to find that information. One of the fun parts about being a pediatrician is that you can get kids really excited about some of the stuff you do with technology. So every now and then when I have a patient who I can tell it would just really get a thrill out of seeing things like that function, I'll pull them over and say, hey, why don't we take a look at your problem list or your medication list? And then I'll queue up the command and it'll pop right up there, and they'll get really excited and ask me to ask it for several other things. So that's one of the really fun parts about having the technology and just kind of showing the promise of what it could be. I do use it in front of my patients, and mostly to get feedback and just to get an idea of what they think would be interesting things for me to be able to ask it. I am so excited about just the concept of having an interaction with a patient and having dialogue and making eye contact, figuring out what's going on, helping to understand their problems without the computer being this kind of intrusive third party, and having this computer being this amazing tool that's augmenting all of the work we do and capturing in the background all of the manual things you'd have to scribe, all the orders you have to put in, and collecting all that and making all that visible when it's necessary, and then taking care of stuff in the back end when it doesn't have to be presented right away. I think we're just on a really exciting step moving towards that path, and having a voice assistant that you can intentionally ask for, but also be able to passively understand the things you say, and also getting to the point where it not only understands the things that you're saying and requesting, but can be smart enough and stealth enough where it can proactively give you information. And that's just such an interesting, delicate balance that you'll have to accomplish. So I think we're on the very first steps to what's going to be really a monumental way in the way we change how we're taking care of patients and how we're interacting with technology.